What do you think is the most common symptom of prostate cancer? Trouble weeing? Aches and pains? Bleeding? I'm a doctor in the UK and sadly, I have a lot of patients who've been diagnosed with prostate cancer. Some have lost the battle, some have won, and some are still fighting. And I know these men really well, so I asked a few of them one simple question. What symptom do you wish you'd paid more attention to? And what shocked me was most of them said the same thing. So in this video, let's find out the most common signs of prostate cancer, have a look at what my patients said, and figure out a way you can pick up a potential cancer. We all know we're supposed to be aware of prostate cancer, and rightly so, because 1 in 8 of us will get it at some point in our lives, making it the most common cancer in men. We hear about it on the car radio, we see signs in bathrooms, it pops up on YouTube, and chances are you know someone who's had it. Or maybe you've had it yourself. And when you hear it or see it, it hits you, right? You think to yourself, maybe I should get tested. Some of us will go so far as to get the PSA test, but most of us, life happens, things get busy, and we just move on and forget about it. The problem is, as good and all as awareness campaigns are, they're not enough. Prostate cancer doesn't pick awareness months to come and happen. It can happen quietly at any time. So you need to know how to pick it up yourself. This one is relatively uncommon, but it's scary as hell. You might have read about Chris Hoy, the multi-medal winning Olympian. His prostate cancer was only picked up when it had already spread. And sadly, when it shows up late, that's how it tends to appear. With bone pain, that's where prostate cancer spreads to. Now don't panic. That's not how most prostate cancers show up, and it's rare for it to start with just bone pain. But if you're a fella, particularly an older fella, who has an ongoing bony pain like a backache that just won't shift, go and get it checked with your doctor, because sometimes that's the only sign. This is the red flag that will get your attention if it happens, because it's bloody scary, right? Literally. If you see blood in your urine or your semen, most men will panic. And maybe that's a good thing, because it will make you seek help, right? Now the good news is, if you notice blood in your semen or urine, it is far more likely to be something other than prostate cancer. But obviously, don't ignore it, because it can be a way that prostate cancer presents itself. Like the bleeding, this one isn't specific. Erectile dysfunction can happen for a number of reasons like drugs, age, stress, heart issues, but prostate cancer is one of them. And there's a problem with erectile dysfunction, and that is that most fellas just ignore it. Maybe you feel a bit embarrassed, or maybe you try to fix it yourself. It's normal for things to slow down a little bit as you get older, but it can be hard to tell the difference between what's normal and what's erectile dysfunction. If you're interested, I have another video on that you can go have a look at. Okay, this is the one you're probably screaming at me. Prostate issues and urinary symptoms go hand in hand, right? And yeah, they can happen. Going more often, getting up at night, struggling to get the flow going, weak stream, dribbling at the end. But when those symptoms happen, it's usually because the prostate has gotten a bit larger rather than cancer, although cancer can do it too. So if it's not the most common symptom, what is? Now here's the answer my patients gave me. I say answer, some of them just looked at me confused, and some of them said it outright. No symptoms. That is the most common way prostate cancer presents. And as scary and all as that sounds, it does make sense. Here's your bladder, the tube you pee out of, and here is your prostate. And this is where cancer usually starts, in a quiet part of the gland, away from everything else. So if it grows in this area, it doesn't press on anything. No pain, no urinary problems. But if it grows towards the urethra, it can narrow the tube and cause urinary symptoms. Or if it spreads beyond the gland, it gives symptoms wherever it lands, like bone pain. So as you can see, the absence of symptoms does not mean the absence of disease. So here's the big question. If symptoms can't help us, how are we going to pick it up? Well, bear with me, because this is where the burglar alarm system comes in. This will make sense in a minute, I promise. Right, imagine we're the police and there's a burglary problem in our town that we're responsible for overseeing. But we have limited resources, so we have to find a way that we can catch these burglars before they ransack a house. Here's what we might do. First, we'd identify the high-risk houses, and that might be in the wealthy suburb where the owners have gone away on holiday, or it might be on the dodgy side of town where crime rates tend to be higher. And now we've got areas that we can put our limited resources, by which I mean our security cameras. Now, they're not perfect. Sometimes they mistake the postman for a burglar, or sometimes the burglar can find a way in and around the back of the house. But we do have a fail-safe, a house alarm. If the burglar gets into the house, the alarm goes off and calls us, the police. And that, in a very strange nutshell, is how we look for prostate cancer. The high-risk houses are the ones we need to be concerned about. That's black men, men over 55, men with a strong family history of prostate cancer. With those men, we deploy our PSA blood test security cameras. They're not perfect, sometimes they miss cancers, and sometimes they raise the alarm on cancers when it's not cancer, but it's the best we've got. But remember, we also rely on the house alarm. That's symptoms. If a man gets symptoms, we rely on them to go to the doctor. And there's a couple of ways of looking at it. One is to say, maybe that's good enough, because the quiet ones that don't set off the alarm, well, maybe they're not going to cause trouble anyway. Autopsy results of older men showed that up to half of them had prostate cancer and didn't even know it. And it didn't kill them, earning prostate cancer the cliche. It's the cancer you die with, not the cancer you die from. And the nastier prostate cancers tend to grow faster, tend to poke their head above the surface, and tend to set off the alarm system. But still, that doesn't sit right with me. The weak link here is the PSA blood test. It's just not very good. It sets off the alarm unnecessarily, and it misses prostate cancers. We need something better. Well, as it turns out, there might be something better at long last. A new test that is far more accurate than the PSA. Have a look at this video here to find out more about it. Thanks for watching today. I hope it was useful for you. And to find out more about the new test, I'll see you over there.